Hi everyone, Angelique here from Proactive Pelvic Health Center, and today I wanted to spend a few minutes to chat with you about the use of vaginal dilators. So first of all, what are vaginal dilators? Dilators are therapeutic devices that can be used internally to help improve the accommodation, flexibility, and stretch of the tissues around and inside the vagina. So we have a couple sets here. My first set is a silicone set, and we can see the different sizes of the dilators, and we can use these progressively to be able to improve the health and the flexibility of the tissues. We have another set here. This is a plastic set, but again, it comes in progressive graduated sizes, which we can increase over time. And we really want to improve the accommodation and stretch of these tissues for the purpose of whatever our client's goals are. For instance, someone may want to resume or initiate penetrative intercourse or be able to have internal sexual play. Clients may also want to be able to insert a tampon and are struggling with that. But clients may also simply want to be able to maintain the health of that pelvic area, but also be able to have medical or gynecologic exams pain-free. So what medical conditions do we usually use vaginal dilators for? The first and foremost are pelvic pain conditions. So some of these conditions you may or may not be familiar with include vulvodynia or vestibulodynia, vaginismus, where we have a spasming of pelvic floor muscles, painful bladder syndrome or interstitial cystitis, or dyspareunia, which is essentially the medical term for painful intercourse. So a lot of these pelvic pain conditions will often present with an underlying dysfunction in the pelvic floor muscles, and oftentimes that dysfunction is that of muscle spasm or excessive tension in the tissues. So pelvic pain conditions may definitely benefit from dilator use. Another population that could benefit from dilator use is post-cancer clients. So oftentimes after chemo or radiation, the tissues in and around the pelvic area can become really restricted, sometimes fibrotic, and sometimes can lose that sort of flexibility and elasticity. So dilators can be helpful to regain some of that mobility. And dilators can also be helpful post-operatively. So some surgeries that may benefit from dilator use are hysterectomies, vaginoplasty surgeries, or gender affirmation surgeries. And last but not least, I wanted to mention the postnatal or postpartum population. So after having a vaginal delivery, if there's any perineal trauma or tearing in the tissue, or after an episiotomy, if there's scar tissue that's restricting that area, then vaginal dilators may also be indicated. So if you're not sure if you're a candidate for the use of vaginal dilators, chat with your family physician, your gynecologist, or one of our pelvic physiotherapists here at Proactive Pelvic Health Center, and we'd be happy to assist you further.